I think every time you're with a patient is an opportunity to somehow give something back to them. And really, mostly what doctors give is advice. But if you make effort and you make them feel comfortable and you make them have a better experience, because there's always pain, there's always suffering in life, and you can't get rid of it. It's how you react to it that's really far more important. So I try to teach that and give that as part of my everyday activities into my patients and to my staff.
The most compelling thing is the family history.
My dad was a gastroenterologist, and I dabbled in that when I was in medical school. I did some rotations, but on the first day of rounds, I was just struck by cardiology. I enjoyed reading the EKGs, the discussions, the procedures, and it just put the idea in my head. And actually, that was the day that I decided to go into cardiology.
I understand that they did an EKG and they saw something and they want to have it checked out. Is that correct?
I was at the cath lab for 9 years as a director, and it was at that time that I worked to build up my private practice more and actually went into the vein business. As I was coming out of the hospital, that's when I kind of went more into both full-time cardiology, but also into varicose veins as another part of the practice.
I'm not impressed with the EKG. A Q wave in lead 3 is not necessarily pathologic. That's what they're seeing. They can kind of come and go. It depends on the axis of the heart when they use EKG. I'm not so worried about that.
The key to being successful is to stop holding on to all those sort of backwards ideas, because often they don't work.
Make sense?
For example, an echocardiogram, which is a very common imaging test. We take a picture in one view and a picture in another view, but really the pictures are the same. But because they've always done it that way, and they still do it, they take another 30 extra pictures, which wastes another 15 minutes, and it's not yielding any additional information. So what I do is I try to eliminate all the waste and do things efficiently as possible. What most doctors will find is that they are so busy trying to generate the revenue in order to keep the practice going and make a living, they have no time to either think about what they're doing, to manage their staff, to manage their supplies, to do anything else besides just go, 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 go. And when you do that, you lose sight.
That's normal.
My advice to anyone is choosing your staff properly, knowing what's important for you and for your practice, and then letting go of those things that are not working is the way to really grow and to be successful. I'm Dr. Adam Goldman, and the name of my practice is the Metropolitan Vein and Aesthetic Center.